D tier, minor. These barely count as disorders. Almost everyone experiences these at some point, and they're not a sign anything's wrong. Hypnic jerks. That sudden full-body twitch or falling feeling right as you drift off. That's a hypnic jerk. As your body settles down to fall asleep, your brain and muscles are basically powering down together. And every so often, the signal gets a little crossed, and your muscles jerk like you just felt yourself falling. There's a fun theory that this is left over from when our ancestors slept in trees, though that's more of a fun guess than a proven fact. It happens more if you've had caffeine, you're stressed, you're low on sleep, or you worked out hard right before bed. Almost everyone gets these sometimes, and there's nothing to fix. Cutting back on caffeine and stress before bed just makes them happen less. Sleep inertia. That groggy, foggy, why is the world blurry feeling right after you wake up? That's sleep inertia. Your brain doesn't switch on all at once. Some parts wake up faster than others, and the part in charge of clear thinking is usually one of the slowest. It's worse if you get woken up out of a deep sleep instead of a light one, and worse still if you're already running low on sleep. It usually clears up in 15 to 30 minutes. Getting some light on your face, moving around, or timing your alarm for a lighter part of your sleep cycle can all help it fade faster. Occasional snoring. Snoring happens when the loose, floppy tissue at the back of your throat vibrates as air pushes past it while you sleep. Sleeping on your back, drinking alcohol, a stuffy nose, or extra weight around the neck can all make it louder. On its own, occasional snoring is harmless. It's just noise. It only becomes worth worrying about when it's loud and constant and comes with gasping, choking sounds, or times where it actually sounds like breathing stops. That combo is a sign of something much further up this list. C tier, mild. A bit more annoying, but still generally nothing to lose sleep over. Nightmares. Nightmares happen during the part of sleep where most dreaming occurs, usually toward the end of the night. They're often set off by stress, anxiety, a scary experience, drinking, or even certain medications. They're extremely common in kids and tend to happen less as people get older. When they start happening often enough to really upset someone or mess with their day, doctors call that nightmare disorder. And frequent nightmares are also a common symptom in people dealing with PTSD. But the occasional bad dream is just part of having a brain that dreams. Sleep talking. This is exactly what it sounds like, talking, mumbling, or even having a one-sided conversation while you're asleep. It can happen at almost any point during the night, and the person usually has zero memory of it the next day. It tends to run in families and is almost always completely harmless on its own. It only tends to get more attention from doctors if it's showing up alongside other things like sleepwalking. Delayed sleep phase. This is when someone's natural body clock is set noticeably later than everyone else's. Think of someone who genuinely can't fall asleep before 3 a.m. and can't function before 11 a.m., no matter how hard they try. It's especially common in teenagers and young adults, since the body clock naturally shifts later during those years. This isn't just liking to stay up late. It's a real, lasting pattern where the person can't just decide to fall asleep earlier, even when they try hard. Doctors usually treat it with bright light in the morning, melatonin in the evening, and sometimes a gradual schedule shift over several days. B tier, moderate. Now we're getting into things that really do get in the way of daily life, even if they're not emergencies. Chronic insomnia. This is when someone has trouble falling asleep, staying asleep, or waking up not feeling rested at least 3 nights a week for 3 months or longer, with a real cost the next day, like feeling wiped out, unfocused, or on edge. It can happen on its own or alongside things like anxiety, depression, ongoing pain, or as a side effect of medication. The best long-term fix usually isn't sleeping pills. It's a type of talk therapy built specifically for insomnia, which retrains someone's habits and mindset around sleep. Medication is usually meant for short-term use only. Restless Leg Syndrome. This causes an uncomfortable crawling, tingling, itchy from the inside feeling in the legs that only eases up when you move them, and it tends to get worse in the evening or whenever you're sitting or lying still. It's linked to a brain chemical called dopamine not working quite right, and very often to low iron levels in the brain, even when blood tests show normal iron. It can run in families or show up because of pregnancy, kidney problems, or low iron. Treatment ranges from taking iron supplements to medications that help with the dopamine issue or calm the nerves. Sleepwalking. Sleepwalking happens when someone partly wakes up out of very deep sleep, usually earlier in the night, without actually becoming aware of what's going on around them. It's way more common in kids, and most grow out of it by their teens. It can be set off by not getting enough sleep, a fever, stress, certain medications, or even just sleeping somewhere unfamiliar. Since the person is moving around with basically no awareness of their surroundings, the real danger is getting hurt, which is why things like locking doors and clearing clutter near the bed matter more than any actual treatment. Circadian rhythm disorder. This is a wider category. Shift work is the classic example, where someone's internal body clock is constantly out of sync with the schedule they're forced to follow, like working overnight shifts. It leads to a constant buildup of lost sleep and lower alertness during the hours they're supposed to be awake and sharp. Over the long run, it's been linked to a higher risk of heart problems, weight gain, and mood issues. It's usually managed with careful use of light, well-timed melatonin, and planned naps around work shifts. A tier. Severe. These seriously get in the way of daily life and can put someone or people around them at real risk. Narcolepsy. One type of narcolepsy happens because the body's immune system mistakenly destroys a small group of brain cells that make a chemical responsible for keeping you steadily awake during the day. Without enough of that chemical, the brain can't hold a stable awake state. The main symptoms are overwhelming sleepiness during the day, sudden sleep attacks, moments of sudden muscle weakness triggered by strong emotions like laughing hard, waking up briefly unable to move, and vivid, dreamlike experiences right as you're falling asleep. It usually starts showing up in the teenage years or early 20s. It's genuinely dangerous because those sudden sleep attacks can happen while someone's driving or doing anything else where losing consciousness for even a second is risky. Treatment usually includes medications that promote wakefulness, other medications for the muscle weakness episodes, and scheduled short naps built into the day. REM sleep behavior disorder. Normally, your body is basically paralyzed during the dreaming stage of sleep, so you can't physically act out what's happening in your dream. With this disorder, that paralysis doesn't fully kick in, so people end up punching, kicking, yelling, or even jumping out of bed while acting out a dream, which is often about being chased or attacked. It shows up most in older men, and it's genuinely risky since it can injure the person or whoever's sleeping next to them. What makes it stand out medically is that it's one of the strongest early warning signs for certain brain diseases that show up later in life, like Parkinson's disease. Many people diagnosed with this go on to develop one of those conditions years down the road. It's managed by making the bedroom safer and using medication to cut down on episodes. Night terrors. These happen during a deep stage of sleep, usually in the first few hours of the night, which is different from nightmares, which happen during dreaming sleep and are usually remembered afterward. A night terror involves suddenly waking up in a state of intense fear, screaming, a racing heart, sitting bolt upright, while not responding to anyone trying to comfort them, and having no memory of it the next morning. While this is common and usually nothing to worry about in young kids, it's much rarer in adults, and when it does show up or stick around, it's often tied to stress, lack of sleep, other mental health struggles, or another sleep problem, like sleep apnea, setting it off. S tier. Life-threatening. If left untreated, these can kill you. This is the top of the list for a reason. Fatal familial insomnia. This is caused by a faulty gene that gets passed down through families. It leads to a buildup of damaged proteins in a part of the brain that helps control sleep. Because it's passed down genetically, a child of someone with this condition has a 50/50th chance of inheriting it. It usually starts showing up in someone's 40s or 50s, and it follows a brutal, fairly predictable path. It starts with worsening insomnia and small changes in things like blood pressure and body temperature, moves into panic, paranoia, and almost complete loss of sleep, and ends with a total inability to sleep at all, rapid physical decline, and death, usually within about 8 months to a few years after symptoms start. It's incredibly rare, with only a handful of families worldwide known to carry it. And right now, there's no cure or treatment that changes how it plays out. Severe obstructive sleep apnea. This happens when the airway at the back of the throat keeps collapsing shut during sleep, blocking airflow even though the body is still trying to breathe. Each blockage causes the oxygen level in the blood to drop and forces a brief wake-up so the airway can reopen. And in severe cases, this can happen dozens of times every single hour, all without the person even realizing it's happening. Things like extra weight, the natural shape of someone's airway, getting older, and drinking alcohol can all make it worse. If left untreated, severe cases are linked to high blood pressure, heart attacks, strokes, dangerous heart rhythm problems, and a real jump in the risk of dying suddenly in your sleep. On top of daytime sleepiness bad enough to raise the odds of accidents. The most effective treatment is a machine that gently keeps the airway open with steady airflow while you sleep, along with things like losing weight, changing sleep position, a dental device, or in some cases, surgery. So that's the full tier list, from a little twitch as you fall asleep, all the way up to a disease that takes away someone's ability to sleep at all. If something in the A or S tier sounded familiar, that's not a video diagnosis, that's a go talk to a doctor situation. If you enjoyed this, smash that like button, subscribe if you're new here, and drop a comment down below. Let me know how you would have ranked these, or if there's a sleep disorder I missed that you want covered next. Also, this video took over 3 weeks to make, so I would really appreciate if you subscribe to my channel to motivate me to make more videos on this channel. Thank you, and see you later.